So this is an important slide. The next two slides are going to tell you that until your daughter is 25 years of age, her prefrontal cortex is going to continue to develop. Your son will develop until he's 27. I tell parents generally don't kick your kids out till if you're a daughter 25 and your son out at 27. This is when the prefrontal cortex, the decider of your brain, your executive function is fully completed. Up until that point, if you were a psychologist and you held up a card that said blue and red ink and you said, what color is this? This is called the swoops test. A kid will jump at the answer, red or blue. After 25 or 27, you'll say, Dr. Stuller, could you clarify your question? Are you saying what color is it written in, or what does the word say? So the bottom line is that this prefrontal cortex, look at the myelination that occurs. The blue is myelination. So by age 20, and if you look in the next slide, you're going to see that the brain continues to develop. Do you see how much you're filling in by age 20? Think about how you felt differently about boys or girls as a teenager between the ages of 12 and 20. That's a lot of myelination as far as discerning factor. This is one of our popular slides. We're happy to get this for you before you leave today. This is called Which Brain Do You Want? These two children here in the middle are 16-year-olds that have never done drugs. When we look at SPECT imaging, we're looking at blood flow to the brain. We're looking at fullness. All of these other children on the periphery here are age 16 to 22 are using some drug of abuse. If you see a hole in your head, it doesn't mean you have a hole in your head. It means that you're not getting good blood flow to your brain. Of interest, once you stop a drug, the brain trends back to normal, with the exception of this bottom brain. These are kids that huff gas or glue. Remember that your brain is a big blob of fat, and solvents are fat solvents. Gas and glue are fat solvents. You will dissolve the cortex of your brain, so this is a difficult thing to recover from. This is actually an ad by Allstate. Driving rates go down at age 25. This is when your insurance rates drop, because by age 25 you stop running yellow lights or you stop picking bad peers. This is when your executive judgment is filled in. And in particular, this red part is your prefrontal cortex, which continues to grow. Here's another example. When I worked as a paramedic before medical school, the parents who bought this kid a truck, this is a double cab pickup truck with full reinforcement steel. And I can tell you that it takes a lot of force to bend a pickup truck like this in half. But when you mix alcohol or cannabis, do you see that it causes decreased blood flow to your already immature prefrontal cortex? And it decreases blood flow to your temporal lobes. As a result, you're going to be more impulsive, and you may have difficulty learning from your mistakes, which is very frustrating to parents when they can't understand why the kid can't get it, that this is a dangerous thing. Again, I'm going to show you shortly how the brain gets hijacked in this process. And right in the mid part of the brain is where a lot of your addiction hijacking takes place, mainly in the nucleus accumbens. Plasticity takes place, which means that if you're a young kid, your brain is constantly growing. We grow from the back to the front of the brain, and then we dement from the front to the back. So as we're growing, plasticity changes are constantly taking place, and when you're using a drug of abuse, you're actually changing this in the process, which is double trouble. So again, I can show you what can take your shiny-eyed children, hijack their brain. And right now, our kids are dealing with a lot more stress than probably at our age. I'm 52 now, so I was a class of 1980 when I graduated from high school. As we continue through, drinking, of course, is becoming quite popular. And if you'll notice, there's a desensitization process that's happening surrounding alcohol. Mom and Dad, I'm not doing pot, so alcohol is okay, right? So, and you've got to say no. Sometimes they'll try to double trap you using that analogy. And if you see young adults, this would be a normal looking surface brain. You can see that alcohol is very toxic to the brain. Additionally, alcoholics or drinkers often have falls. I've seen plenty of DUI arrest tapes where kids are handcuffed with their hands behind their back. They'll fall forward, hit their prefrontal cortex on the concrete. And what compounds drug and alcohol problems is when you compound it with an injury on top of that, it slows down progression. And just to let you know that drinking is not okay, this is a 15-year-old male non-drinker. The red is suggesting that we've got a lot of activity going on in the brain. This is a 15-year-old male heavy drinker. Do you see how this hijacks the brain and shuts down activity? Nicotine. Don't underestimate nicotine. Again, mom, dad, I'm not drinking, I'm not doing pot, I'm just smoking. But if you go to the next slide, and this includes smokeless tobacco, you will see that this speaks 1,000 words, in my opinion. Look at how nicotine takes over the brain, how quickly. This is no cigarettes, 1 puff of a cigarette, 3 puffs, 1 cigarette, 3 cigarettes. Absolutely hijacks the brain and the neurotransmitters, especially in the nicotinic system. Remember too that even though you think of alcohol and opioids and cocaine and heroin as being a major killer, remember that tobacco is still way up there. So teen smoking is still very problematic. And just because, again, your kid is smoking marijuana and they say, hey, at least it's not crack cocaine, this is not okay, as you will see. Cannabis, as we know, we're facing these legalization. Think of this as desensitization laws. Are you getting that feedback from your own kids? That if it's being legal somewhere, it must be okay. They didn't really consult doctors in the process. This was a lot of legislatures and special interest groups that pushed this bill forward. Okay, Britt? Britt, I may need to keep the pace up a little bit. On cannabis, and if you start seeing strange things around your house, I need you to start being an observant parent. If you see strange pipes, these are called vaporizers, which improve the quality, the content, and the delivery system. This is often a trick word question, but the quickest way to get a drug to your brain is by smoking it. And so this is extremely toxic. If you see glassware or pipes or bongs, you may see small pieces of foil, which will hold pieces of crack cocaine or hash or other low-grade marijuanas. Pay attention to what you're seeing in your children's rooms. Marijuana, again, is going to hypoperfuse. It's going to decrease blood flow to your prefrontal cortex and to your temporal lobes. Again, your child's going to have trouble with concentration, attention, and motivation, and they're going to have trouble remembering from their mistakes. They're going to try to convince you that they're actually more relaxed when they smoke marijuana. However, if you actually did a fine motor skill test, you would find that they would not do so well if you asked them to parallel park, or if they were to get high or you catch them high, have them try to parallel park your car in the driveway, hopefully in a safe place, just to show them that they're not doing quite as well as they do. Now, does anyone know the difference between swag and chronic? These are different types of cannabis. Notice how this looks like nice, good green grass. This is called chronic. The other is swag, which is more of a low-grade weed. Your children are going to be well versed in what's available in their high school markets. Chronic, again, looks like a nice crystalline. You may see small crystals like someone sprinkled sugar on top of this. And if you go to the next slide, I'll show you in the real marijuana cannabis plant, do you see how it looks like almost a crystalline structure? This would again be called chronic bud. I need you to pay attention to your children's text messages. If you see, I had a kid trying to go to Philadelphia with his mother. The mother was trying to go to Philadelphia. The kid was trying to go to Fiji. He was high on K2 and spice. She convinced me that my son does not do drugs, Dr. Stuller. I said, take his text messages, bring them back to me. And he was looking for legal bud, which is another name for K2 or spice. Often you'll see these are dime bags or nickel bags. Again, if you see, this is not from their home jewelry. This may be cannabis that they're using, so you need to notice this in your laundry and pockets. And again, you can't argue with a picture of your brain. I had a young man come in who was 15 years old, already smoking about 1 gram of cannabis a day with a vaporizer. Both of his parents were high school teachers. He proceeded to persuade me that cannabis should be legal, and I said, you can smoke all the pot you want, you're not hurting my brain, but I want you to show you that you can't argue with the picture of your brain, and that's the beauty of the SPECT imaging, because I can show kids that when you smoke marijuana that you definitely will hypoperfuse these regions, and you can try to convince me that here's the living proof. But I'll also show you, by showing them the pictures, one, and often most kids will say, I'm never going to smoke pot again, because I realize now that it isn't true that nothing's happening to my brain when I smoke marijuana. Now, DUIs, you cannot afford it. It's going to cost you about $2,500 on average to hire an attorney to just get your child's potential DUI either mitigated down to a misdemeanor or a reckless driving offense, but it's extremely expensive. I had a WISE attending once tell me that bad things happen after 10 p.m., so it's good to be in bed by 10 if possible. Drug driving of interest, vehicular accidents are the #1 cause of death for children aged 16 to 19, and alcohol is #1, followed by cannabis. So again, your children will try to convince you that cannabis is not an issue, but you need to have them look at these statistics. Between 2001 and 2006, 14% of high school students in the Monitoring the Future survey admitted to driving under the influence of marijuana. Remind them that buzz driving is still drunk driving on many different levels. Again, working as a paramedic and working with the coroner, the first thing we do for a dead on arrival is they're going to put a deep syringe right into your heart and draw blood to look for all substances. And when you're doing a breathalyzer on a roadside stop, or if you've been pulled over, they're also going to be doing blood testing on those patients as well. So this is when they get double tagged with both the marijuana and an alcohol charge.
This is the next.
Okay. And again, so as I was saying, alcohol is #1, followed by cannabis, to most people's surprise. Crack cocaine and cocaine. This is a good year for heroin and cocaine. I've had a few kids tell me that they don't want to stop heroin or cocaine this year because the quality is the best it's ever been. It's like a good year for champagne. And so again, you need to be looking for paraphernalia around your house, glass pipes. If you're missing your antenna, by the way, these are often used for crack pipes. And so if you also see burns on people's lips, notice they'll try to convince you it's a fever blister, but if you see a burn both on the upper and lower lip, your child may be abusing crack cocaine through an antenna or through a hot glass pipe. K2 and spice, often known as herbal marijuana. This has been disastrous, and you're going to see more and more. We're getting lots of hospitalizations on K2 or spice. If you go to the next slide, by the way, it looks almost like condom packages or sugar packets, and there's what looks like a potpourri inside. And if you're a drug dealer, the reason that the feds cannot keep ahead of this is that if I was a drug dealer, I could simply take a methyl group and add a ring here, or by manipulating one methyl group or one ring structure, I can slightly change the picture of K2 or spice. As a result, on the next slide, you're going to see that there's lots of different names for the different K2 and spices. Now, most drug testing facilities are just now getting up to snuff on looking for K2 on spice, but the truth is we are only testing for 3 to 5 of the major K2 and spices. There's already at least 50 on the market that we're behind on. They're often shocked when they go into detox rehabs in the inner cities of Baltimore where I work, and everyone will look negative for marijuana, looks like they're turning in good drug screens, but if we secretly test for K2 or spice, about 1/3 of the population will come up positive for K2 or spice. Again, look for these strange names on your child's cell phone. Synthetic cannabis can precipitate psychosis, and it can precipitate permanent psychosis, or if you're particularly vulnerable, suppose that you're inevitably going to develop a bipolar or a psychosis, this could speed things along more quickly.
What is spice?
K2 and spice, kind of the same. They're both AKAs. They're just
K2
herbal marijuanas. You may hear it referred to as K2 or spice. They're sold in the same looking packages. They're just slang words for the synthetic cannabis.
But K2 is just a synthetic, it's a type of.
They're both synthetics, and
Okay.
they will all vary in molecular structure. Of interest, what do you think the #1 cause of death is right now in our young people? It's actually prescription opioids. The #1 place where kids get prescription opioids are from your cabinets and your bathrooms. It's not surprisingly from the street. They're very versed. Oxycontins, which are now being stopped in production, an 80 milligram will go for about $80 on the street. If you're a white kid from Loyola, if you're inner city, you might be able to score it for $50 versus if you were getting a Percocet, those may be $5 a piece. So you need to also watch where your child's spending dollars are going. Heroin is still alive and well. We're also seeing a rash of recent deaths, especially in the Washington, D.C. area, Pittsburgh, and Baltimore, where they're mixing a new type of fentanyl with the heroin. We had the same problem several years ago, and this can cause an overdose. Remember, the opioids cause respiratory depression, which can put you into respiratory arrest. So often, as when I worked as a paramedic, we'd find you down purple or blue where someone stops breathing. Heroin and methadone, again, very toxic to the brain, as you can see. Again, this is normal, and high doses of heroin, and even though they say that methadone is safe, same thing with benzodiazepines, we do see a very toxic pattern on the brain scans. Benzos and sedative hypnotics, again, they're going to be rifling through your cabinets at home. It's very important that you keep these under lock and key. These can include Xanax, Ativan, Klonopin. These go for anywhere from $1 to $5 in your local high schools. They're quite prevalent. You might be surprised if you had a heart-to-heart with your son or daughter that's in high school, what's coming through their area, how much it costs, and it's important to stay abreast of those trends. Or hang out with me for dinner sometimes and I'll tell you what's going on. And don't just lock your drugs up in any safe. Recently I had another mother calling me furious because the son had gotten into her OxyContin stash. And what he did is she thought she finally had him locked out. You need to get a heavy vault like this, and it should be bolted into your closet because kids can also take them out and blow them up. But what this kid did is he took the yellow highlighters inside of the marker. He said, "My mother's so predictable." I said, "Well, how did you learn to do this?" He said, "When I was a kid, we would take magic markers and fluoresce them in Coke bottles with water, but I noticed it left a residue." So he left a residue around. So his mother, he said, is so predictable, punch 1, 2, 3, 4, so he fluoresced it and got into her safe and got the drugs. So if you're going to get a safe, get one of the old-fashioned combination dials with the heavy deadbolt so that it's not a key thing. They will, if you know how well they find your iPods and your gaming devices, they're just as clever at getting into your home safes. I have special deals with safe suppliers now, just so for frustrated parents. Methamphetamine is a drug that sells itself. It is extremely potent. If you had good sex or a good meal, you might release 3 to 7 times dopamine. If you do cocaine, you're releasing about 100 times dopamine, which is very toxic to the downstream neuron. Methamphetamine is 1,000 times dopamine. It's going to take out several neurons. And if you see in the next slide, I'll show you that it's incredibly toxic to the brain. It just floods the synapse with a lot of dopamine. And in the next slide, you'll see that it really damages the brain. And I think sometimes it's almost irreversible damage. Sometimes we call it the dopamine dance. Kids will look like they have a jerk, or even in their sleep, they'll be quite jerky or almost spasmodic. And this is disruption of the dopamine pathways, which are part of movement. Cocaine and methamphetamine, again, methamphetamine, this is again one of the most potent and dangerous drugs on the market. I just want you to take a look, and these are young people. Look at the before and afters of how methamphetamine ages you. Do you know who this is? This is Cully McCulkin on Home Alone. This is him in his healthier days. If you go up a little bit more, you can see do you see how he looks almost stiff or Parkinsonian-like? This is again an effect of flooding all of your dopamine synapses. But do you see how quickly this ages a person? And methamphetamine is one of the most difficult drugs, in my opinion, to get off of. We have a lot of meth sex rings as well in our young, I have attorneys, doctors that are meth sex addicted. It's a very, very potent drug. Bath salts, anyone familiar with bath salts? Mm-hmm. Bath salts are another, this is not something you put in your tub, trust me. It might say that this is ivory salts or vanilla sky. They again come in small packets or baggies, and bath salts are a combination of almost like a cocaine and a methamphetamine. They're about 10 to 30 times more potent than cocaine is. The reason that bath salts are very dangerous, imagine that a faucet is the way we leak dopamine into our brain. We just dribble it into our brain every day. When you take a bath salt, it's like you're turning on the faucet of dopamine, and then you're plugging up the drain with the methamphetamine component of the drug. So you're completely flooding the synapse, which is why psychosis occurs so often with these particular drugs. Red Bull. Red Bull is a problem, so is Four Loko in the next slide, but in the Red Bull, these drinks carry anywhere between 80 and 400 milligrams of caffeine. If you think about it, most Americans taking a Red Bull should be having tachycardia, hypertension, possibly even a heart attack or a seizure, but they load these drinks with taurine, which is like pouring lidocaine on the heart so you can take the adrenaline hit. So it's trickery. If you go to the next one, there's also becoming popularized where people will take a vodka and a Red Bull, or the Four Loko, which we've had some deaths on now, is a combination of a high potent mixture of malt liquor mixed with caffeine, and they come in quite large cans. And so some of this has been pulled off the market, but they're still coming out in a variety of other different things. Monster drinks are not, they don't have the malt liquor, but the monster drinks are also quite potent in caffeine. Study drugs. So here I prescribe these things. However, I don't like to say this in front of too many people, but I will tell you since you're here from an educational, XRs are not supposed to be abused, but if your Adderall XR is opened up, it can be dried under a heat lamp and then crushed, dried, snorted, or injected. This is Concerta. Concerta has a push-pull cavity, so if you break the capsule, you will destroy the release mechanism, so it's a little bit safer. Ritalin and Focalin can be crushed and snorted, so I'm very careful with how much I prescribe and whether I'm going to give your child an immediate release or an extended release. Vyvanse, actually this is a Vyvanse here, I apologize, which is the 30 milligram there. Has a safe release. What they did is they finally attached the digestive enzyme, so you cannot inject it or snort it. It must go through your small intestines where the enzyme is cleaved from the drug, so you get a nice, steady, slow release of the drug to your brain. Again, these were not ever meant to be abused because we have a lot of people, but you'd be surprised. I often will ask patients, I say, listen, have you ever tried Adderall or Vyvanse? Did a roommate give it to you, or have you tried it at least once? Now sometimes that's helpful information for me if I'm trying to pick a proper stimulant for you. And to my surprise, about a third of parents have tried their children's stimulant as well to see what effect it's had. Often I get parents coming in addicted on the kid's stimulant. So now if your child says that he needs a stimulant, the beauty of doing brain scans is this is a teenage girl who's not doing drugs, wants to be a veterinarian. Do you see that she's going to have trouble with concentration, attention, and some temper or memory? The next day we take another SPECT scan while you're taking a test. Do you see that the harder she tries, the worse her brain does? She actually hypoperfuses under pressure. And this is her brain on a stimulant. Do you see how the brain fills back in? IQ here, 93, retested 130. Big difference in performance. However, this is not an infomercial for Adderall. First of all, there's new research to suggest that our copious use of stimulants may be causing early Parkinson's disease because we're depleting kids of their dopamine. So it's very important that if your child is going to be on a stimulant, that they should also be taking an amino acid called L-tyrosine, which gives norepinephrine and dopamine, which is like the fuel, and then the medication spins the fuel so that we don't deplete them. Secondly, the most important thing I've learned from doing brain scans is that there is an order in which you have to treat the brain. So if this is Johnny and he's has a bad temper and he's impulsive, I could say, yes, you have attention deficit, give him a stimulant. I've now given him the motivation to go kick ass. Does that make sense? Mm-hmm. So we must always treat the back of the brain first to calm things down, and then we give a stimulant last so that the patient has a relaxed focus. Does that make sense? Mm-hmm. So this is often missed in traditional psychiatry. Good. Inhalants and poppers, dust off, things that are used to clean your computers, wet solvents that are used as carpet cleaners. Whipped cream cans have a little, if you broke the can apart, you'd see a little silver vial. These can be used or huffed, which also give a high. Recently in the 2013 surveys, already 8th graders, approximately 12% of 8th graders have already experienced huffers or poppers. That number has gone down. Number 1 and 2 is usually marijuana and nicotine. And again, be savvy. Just because your child looks like he's a gym rat and he's going to GNC on a regular basis, there are lots of testosterone supplements. I routinely test labs in new young bucks, and I will catch high testosterone levels with low LH levels, and that tells me that the kid is using exogenous steroids. You'd be shocked out of your gore if you knew how popular anabolics still are and how readily available they are on the internet. I can show you internet sites where your child will have cyber accounts where they can keep cash flow, they can order games. And I'll show you some interesting facts about that shortly. Now we have to be careful as parents that we're not sending the wrong message. Remember the old commercial, "Dad, I learned from smoking from watching you"? Well, it's the same thing with our computers. We have to also exercise good judgment in front of our children. Internet addiction, anybody? I've got kids that are gaming most of the day, or if they're not in school, they sometimes are using cell phones at home. They will find their electronic devices in your home. That's why you need the lock-in, bolted-in vault, because they will get to them in your house. You'll wake up. They will game all night long, and you can't understand why your kid keeps falling asleep in class. It's because they're gaming all night long. They often have cyber accounts. Recently, I had a young man who is 13. He's getting beat up at school, so he secludes to home. He takes pictures of his parents' credit cards front and back, so he's ordered all of his gaming devices. He's actually an elite gamer at age 12 or 13. And I pulled in one of my other patients who is a high-level Amazon computer programmer, and I said, talk to this kid a minute and tell me if he's the real deal, or what is his level? And he said, this kid is as advanced as I was at this age, but my father took all my computer equipment, put it in a pile in the backyard and burned it. So, and then sent me to rehab because at 15 I was drinking too much because he said I was gaming 24/7. So again, you'll be surprised at how much you need to get savvy on your internet. By the way, if your son or daughter accidentally was downloading music and downloaded child porn, you're going to get your front door kicked in, which has also happened to one of my patients whose parents are both high school teachers, and you are now responsible because they don't know whether you were watching child porn or your son or your daughter was. But once it's downloaded onto your computer, first of all, it's illegal to look at child porn. Secondly, to download it is now a federal offense. You're talking about years in prison, and this can also jeopardize your job as a parent, because now the feds, someone is going to have to explain liability on insurance to your law enforcement on how this happened on your computer. Video gaming, this is why young men have such poor posture, I think, these days. Look familiar again, trying to get our little whippersnappers away from their computers. Facebook again, this says you have been online for 1 year. If you wish to log off and get a life, yes, no, ask me again in 1 year. So in addition to internet use disorder is really a problem. These kids get complete preoccupation with internet gaming. They get withdrawal when it's taken away. They will pitch a fit. They also build tolerance to the game. These games are designed to keep you coming back. You have to build points. I have some entrepreneur internet addicts that I treat who now game for attorneys, or if I wanted to be a character in a game, but I'm busy being a doctor or a lawyer, then I can hire these young whippersnappers to advance my character during the day, so that I will be up and getting tricks and trades from other people. Again, internet use disorder. The kids become primarily focused on using their internet devices, and they no longer really enjoy doing their ball game stuff or their usual social interactions. I think kids are really getting desocialized these days. It's like they get more social anxiety because they're so used to being cued in on their computer, it becomes uncomfortable. Video gambling, again, one of my first calls as a paramedic was a guy who gambled away $21,000 in one night on video poker. It's quite possible if you're doubling up on your bets. A lot of video games, you may see your child innocently playing blackjack, but they're actually, these games are designed to teach kids how to play better, and they let them do mock betting, so they're actually learning as we speak. Same thing with online gambling. You'd be shocked a lot of times when I get a kid in and I'll say, listen, how much do you owe, who do you owe right now? Because to them, $1,000 debt would be like $1 million debt to us, so they're afraid to come forward. But I have college kids who routinely are being threatened to be beat up or killed because they owe anywhere from 1 to 20 grand. Sometimes they're betting on stupid things like basketball, which is pretty risky. Not to mention horse races. Almost every college campus has bookies now that will take their online gaming bets. Same thing with internet gambling and poker. I'm sure you're seeing more kids playing card games. Has anyone noticed that trend as well? And also online. Pornography, big problem. I have father-sons that come in and the father will say, listen, the more porn you're watching this young, the kinkier and kinkier it gets and the harder it's going to be to have normal relationships in the future. And so we actually see differences in brain scans on compulsive pornography users. So some healthy volunteers won't light up, but often people that are at risk for addiction will light up in particular areas of the brain, primarily the cingulate, for the docs in the room. And the cyber accounts, again, you'd be shocked to know that your child may have a $10,000 account. The 12-year-old has already accrued $13,000 worth of cyber points. I have other grown men who do poker who disguise themselves. He noticed that on online poker gambling that women got favors at the table, or guys would give them extra tokens. So he photoshopped himself as a Brazilian model with a child, and guess what? He got lots of tokens. And so this gets quite expensive into the creative ways that people are using the cyber accounts. Remember that addiction is a complex disease. Brett will pop right through these next few. Usually this is a nice, it's inability to abstain, impairment in behavioral control, craving, diminished recognition of significant problems, and a dysfunctional emotional response. Couple stunning slides is that language matters. When does it become addiction? Is it addiction if your child is experimenting with marijuana? What is the fine line between some use, regular use, or problematic use? Because of this lack of precision, you'll also be surprised to know that the #1 source of referrals is the criminal justice system. Most people do not get help for their addiction until they have a major medical crisis. They have HIV, hepatitis C, until they're in trouble with the law, or until they're dead. Those are the 3 big motivating factors. The rest of the time, it's individuals, community sources, and surprisingly last place is schools and employers. In the United States, on average, there's only about 100,000 physicians on any given day, and of those, about 1,200 are practicing addiction specialists, and only 355 are addiction psychiatrists. Trying to catch addiction early does this ever feel like you as a parent where you're trying to reel the kid in and they've got a one-track mind on where they're headed? The addiction treatment paradigm is rapidly shifting with the advent of nuclear imaging. We're seeing beautiful advancements. On the next slide, I'll show you something called functional MRI imaging, which looks like these nice scans here, and as we begin to understand the brain better, this is going to be the millennium of the brain. Obama has dumped the same billions of dollars that was in the National Genome Project into the brain initiative, and so we're going to know more about the brain in the next 10 years. Something on the horizon is called diffusion tensor imaging. These are beautiful scans, especially in the autistic population. Colors represent different planes, and they're basically shining a light through neuronal tracers, and this is going to be hot new stuff for the near future. Because we can now track the brain, we can also do it in the next slide. If you can get your child to play a musical instrument, that's one of the best therapies that you can do for them. This is someone thinking about music up here, imagining music, hearing music, reacting emotionally to music, and this is someone actually playing a musical instrument. So be careful about band, however. If you were in the LSU band, you would party your ass off. So, but still, music is a wonderful type of therapy. Integrative listening is excellent.
What about singing? Does that
Singing, same thing.
Okay.
Music is
So,
a
instrument or
wave
singing.
across the entire cortex.
How about dancing?
Dancing is also wonderful. Both of those involve left-right coordination. Every day at the Amen Clinic, we're using a combination of quantitative EEG and neurobiofeedback. We're getting advancements now in the fusion of different imaging. So soon you're going to start seeing three-dimensional images like this. We're using neuroimaging, as I've given you several examples today. We're also using genetic testing and neurotransmitter testing, which gives us lots of information. Dr. Amen has been challenging the psychiatric community for quite some time now to be using imaging, because this is we treat the brain, which is not often looked at in traditional psychiatry, through an imaging. And unless you look, you can see that these are two healthy slides. You want to know whether or not your child, A, has trauma, because sometimes they're not getting it because it's not that they don't have ADD, but they may have had a prefrontal cortex injury or a temporal lobe injury from lacrosse or football or a riding accident. And blue is cool, red is hot, white is red hot, like a stovetop. So do you see how hot this brain looks? These are kids that if you don't catch them by the time they're 13 or 14, these are going to be your early alcohol, cannabis abusers, because they're trying to calm the brain down. Imaging, yes?
Why do you have the multicolored and then the dark?
Yeah,
Go back one?
yes, please.
What's the difference between the multicolored on top, the two,
And the purple
and the
below.
purple and red on?
They're just more of a side-by-side, so this would be healthy, nice and full.
I understand that, but why is one of them multicolored and one of them blue and orange? Blue and purple.
The surface hue versus
The
the
surface
structure.
colors are just
Yeah.
simply for orientation, so the color doesn't mean anything there, sorry.
Thank you, sorry about that.
Yes, that's okay. And so imaging is going to really change things, because you can actually see your brain, see if you have trauma, see where you're lighting up. This is, again, we can target which parts of the brain and in what order to treat. This is critical to success. A scan takes 15 minutes for the resting scan and 15 minutes for the concentration scan. So if you could buckle your kid down for 30 minutes, and it's not even scary. The head barely goes in this nice big open area. This is a very quiet camera that spins around. It's not scary or frightening. We have 6 5-year-olds that go through. We've even had infants go through the SPECT imaging. Again, normal surface views can look great. And we also take a look at the inside of the brain. That's okay, but the inside of the brain shows us where the brain is working too hard or not hard enough. Okay? Remember that the inside of the skull is very sharp. The brain sloshes around in cerebrospinal fluid. So when you have an accident, the brain is sliding back and forth, front to back, side to side, and it's getting micro-sheared on these sharp edges. So trauma does matter. Go to the next slide. Again, we want to see if there's trauma. We want to try to, and if you go to the next slide, I'm going to show you the heading is not so safe. Again, with the tensor diffusion imaging, we can already see on the next slide that heading a soccer ball does cause micro-shearing at a cellular level. So we have the proof in the pudding now. So I'm not against soccer, but again, soccer balls travel up to 40 to 50 miles an hour with a good male hit on it, and even with female soccer on a competitive level, it's gotten much better. If you can get your kids into tennis, swimming, golf, dancing, those are much better sports to select if you have a say-so. Again, This is a physician we treated, doing a lot of drugs, and a year later off of all drugs. Do you see how the brain fills back in? And we can also look to see this is depression, where depression lives, anxiety. If this is the snowman with the smiley face, the nose is where depression lives, the two eyes are where anxiety lives, and the cingulate is where OCD lives. Again, we don't have to treat your child with medications. If they have a hot brain now, I can convince them usually not to use alcohol or cannabis. And this kid was just treated with EMDR, or eye movement desensitization training, and St. John's wort. Do you see how it had a nice calming effect on the brain? Dancing, aerobic sports also were very helpful. I can also tell you who's going to be an angry drunk. At LSU, there were 3 guys. There were guys that could come in, go home, no problem. Guys that would drink and then cry in their beer. That's because they'd have a lot of the nose of the snowman. They'd have more depression and anxiety. Do you see how hot this guy's brain is? Do you see when he drinks, he feels better? At baseline, his brain doesn't look terrible, but when he's intoxicated, do you see that he's going to have no brakes on a bad temper? This will be your angry drunk. So we can even predict what type of drunk that you're going to be and whether you're going to be more impulsive. If you have a hot cingulate, the cingulate runs this part of the brain. This can make you stubborn, but it can also get you locked in like a fighter pilot. And often the internet addicted patients and our gamblers have very hot cingulates. Conduct disorder. This makes a kid naturally oppositional. They're usually very smart, but do you see how hot this kid's temporal lobes are on the periphery? These kids are going to fight their way out of an oppositional, possibly with an authority figure. They're going to fight their way out. So this also predicts incidents of potential juvenile risk. Again, same thing with angry oppositional. Do you see how once we treat someone, how we can calm that activity down to prevent them from having to abuse drugs to calm this down? We can show them how to do it naturally and with medications if necessary. If you don't get brain inflammation soon, going back to your nutrition question at the beginning, on the next slide you'll see that often what should be a normal looking brain, do you see how hot the brain can get? Again, if you don't catch this, we're in trouble because these kids are going to abuse some substance of abuse. And on the next slide, I will show you that when we get some kids and we do neurotransmitter testing, when we see elevated histamine, glutamate, GABA, and glycine, this is called inflammation until proven otherwise. In the next slide, the first thing we address with kids is their diet. So lots of sugary drinks, caffeine. This is a wonderful book for those of you. It's called Is This Your Child by Dr. Doris Rapp. It's a nice overview of food sensitivities, and if you don't address food sensitivities, this can drive addiction. We also look under the hood. We do basic metabolic testing. So a lot of people have Lyme disease. Lyme disease can light up your brain. We want to make sure you don't have methylation deficiencies. We check your vitamin D levels. Even a young, healthy appearing male can already have high cholesterol. They can have methylation deficiencies. They can be B12 or anemic because they're not eating, because they're gaming all night, and they're not getting enough sunlight on top of that. We also check for your comprehensive metabolic panel to make sure your kidneys and your livers are okay. I teach the kids those numbers so they know how sick or well their kidneys and livers are. We also look at thyroid function along to make sure that they're not anemic. We also have ways of looking at neurotransmitters and inflammatory patterns. So if you have Lyme, a strep, or a staph in the child's history, I can predict that as a potential source of inflammation. And I can also see that someone who's chronically been depleted, who's been using a lot of drugs, are going to exhaust all of their neurotransmitters. Eventually, if they get too exhausted, these kids are at high risk for suicide. I can also tell you if your child is a normal human or a vampire. For those of you that your kids drag in the morning, this is a cortisol graph. You should have high energy in the morning, be ready to go to bed at the end of the day. If your kid's gaming all night, they're going to drag in the morning, and do you see that they're off to the races at 10 p.m.? So again, we can also predict these cortisol patterns and how to re-regulate that. You need phosphatidylserine to calm that down. Also, by looking at neurotransmitters on the next slide, I can again, sorry Britt, I can predict if everything is low, I know which medications, which supplements to use, and which drug of choice your child is likely to abuse. Or if certain neurotransmitters are high, I'm gonna select a different agent. And on the next slide, I can tell you that with the simple 10-second cheek swab, I can tell you if your kid is gonna be a worrier or a wear. And on the next slide, I can show you exactly what medication selection we should be looking at. So this is, you could do this for ADD meds, antidepressants, or psychotropics. Do you see that here we're down to Prestique and MSAM? So the green column tells you that this would be a good fit for your kids' medications. This tells us that they may need higher or lower doses of the medication, and then in the last column, they're going to need, it's not that it's not a good fit, it may mean that you need extraordinarily higher or lower doses. Finally, SpectraCell nutritional testing is very helpful as well. If you think that your child is nutrient deficient, this is a test that's a 3-month average by going inside of the white blood cell, and it tells me exactly what all of your antioxidants, your B vitamins, your minerals. So these are little things, I call it looking under the hood to be sure that we're tweaking your child's nutrition to be sure that they're topped off properly. I can also, with a simple stool test, tell you exactly the flora is within the gut, or whether they have H. pylori, or whether they have a parasite or something that's driving inflammation. This is again why the combination of scanning and testing is very helpful. We also, Lyme is the great psychiatric imitator. It can make people look anxious, depressed, even psychotic. And so we catch Lyme all the time in our clinic because that we test for it. And again, I need you to be the parent. Sometimes parents forget to be parents. Mm-hmm. You're paying the bills, you're in charge, and so it's important to be in charge of your children's peers. Who you hang out with is often who you will become. And so again, I need you to step up there. Home drug testing. So you'd be shocked at what's on the internet. On the next slide, your child could go on the internet. This is something called urine luck. These are called adulterants that you can send them into the home bathroom and they will actually adulter their test right there at home. So to get around that, I usually tell kids that parents should have some dice so that you're not punitive. Statistically, if you test your kids, roll the dice twice a week. Even you get a test, and odds you don't, you're off the hook. But statistically, if you do that twice a week, you should be hitting at least 4 drug tests a week if there's a problem in the house. Also, I keep kids guessing. Sometimes I'll give them a urine test, sometimes I can do a simple swab. And if I also serve on a committee where we treat impaired physicians, on the next slide, there's even devices now, if you want to really get sophisticated, you could wear a device this small. At any time I page you as a parent or as monitoring a physician, you turn this device on, it gives me your exact GPS location. It actually will then have you do a breathalyzer right there on the spot, and it films you while you do it to be sure that your girlfriend or prostitute are not doing the test for you. You always have to be one step ahead. Guard your sleep in your children. There was an important study done in Michigan where the difference between 30 minutes sleep is the difference between an A average and a B average. Another 30 minutes difference between a B and a C. Sleep is so critical. This is when your brain grows and protects itself in its immune system. Nurture Shock is a wonderful book. It outlines this study. It will tell you why your teenagers lie and what they will lie about. And we can also do home sleep monitoring. So if your kid tells you that he's not sleeping well, I can actually show you whether he is sleeping well or if he's up all night gaming. We doctors are tricksy. Again, you have to support, you've got to put good food on the table. I had one mom that bought $100 worth of all the good supplements and snacks, and the kids will eat what's out. So if you just leave healthy snacks out, there's a good chance you'll capture them.
What's MVI?
Multivitamin.
Oh, multivitamin.
And then we've got lots of medical supplements that you can use for every spectrum from ADD to depression to anxiety, which are all natural. And if you can get your kids into aerobic activity, fortunately I was a swimmer, and it's, as far as I'm concerned, it's why I'm a doctor, because it taught me how to compete, how to push through pain, how to work as a teammate. It was very instrumental, and you can't get into too much trouble if you're running or swimming your butt off all the time. And same thing, last year there were 2,000 unused women's NCAA golf scholarships. 2,000 free rides. Same thing, tennis is a little bit more competitive right now, but if you have sons and daughters that are interested in golf, it's a nice way to pick up free ride scholarships. And finally, I like to say that recovery is an upward spiral, and that I believe that when you get in recovery, you may have some relapses, but I want you to get smarter and smarter with each relapse and eventually get to the point where we don't have relapses. The reason I'm doing what I do here at Amen is, if you go to the next slide, this is a young man, and I'll show you that the brain can change. These are my final 3 slides. This is a guy kicked out of LSU. Mainly pay attention to this one on the bottom right. This is him kicked out of LSU, drinking a lot of drugs and alcohol. The next slide is 2 years later, doing the right things. So we were gaining progress. I can make this happen even faster now, because as I get older and wiser, I can move things along even more quickly, because we build knowledge and skills and advancements in scanning. And then in the third picture, you'll see that after another 2 years, we went from a wrecked brain to a pretty good looking brain there. So even if your child comes in wrecked, this is called creating brain envy, I can show them that it's okay, we can fix this. So trauma is a little bit more difficult to fix, but we want to identify whether trauma is there or not. So I'm going to stop here, because I'm running a little over and I've got to turn it over, but we'll be here to answer questions immediately after.
More and more I was feeling like we're missing some things. The talk therapy is really important and useful, but as I tried more things like meditation and art and working with music and so on, and movement, I began to realize that there was just really more that we could be doing to help people in a more integrative way, to do better faster and to take over. So doing things for yourself, rather than always everything happening in the therapy session. So that's part of why I started doing that. I'm the mom of 2 adults with ADD, so if any of you are parents of ADD kids, or certainly dealing with ADD kids, I sympathize, and I've shared that experience. And I'm just wondering about hearing about all this about drug use and so on, and what that's like for folks to think about it. It was kind of intense for me, thinking about that job of being a parent and sorting, kind of monitoring and sorting out what's going on in your home and your kids. So before I get going, what I'd really like to do is give you a little experience of some of the mind-body things that I'll be doing. We're going to be doing 3 mind-body skills groups here. One is specifically for parents, one is specifically for adolescents, and one is just for everybody, for adults, any adults who are interested. So if you could take a moment with me, if you care to, you don't have to, but just putting down whatever you have and sitting comfortably. So really noticing how you're sitting, and just making yourself as comfortable as you can. And if you wish, you can allow your eyes to close for a moment. So I'm going to invite you to be mindful and present. It's a mindfulness practice of being here and present in this moment. Because a lot of times we get very buzzed up about things we're about to do, or things we're worrying about in the future, or things that have been bothering us from the past, and rehearsing and reviewing old things. So I'm inviting you at this moment to be right here in this room, and see if you can tune into yourself and notice how you're feeling right now. What's your energy level right now? Are you going fast inside yourself? Are you slow? What's going on? And now I'll invite you to tune into your breathing, not trying to change it, but just noticing the movement of your body as you're breathing and what it feels like. And if you're noticing anywhere that you feel a little tense or tight, see if you can relax that a little bit. So bringing awareness to the movement of your breath. Notice where you are when you do that. Are you noticing your breath in your chest, movement of your rib cage? Are you more focused on movement of your abdomen? There's no wrong way. Perhaps you're noticing it in your throat, or even in your nostrils. Knowing that little change in temperature as the air moves past the tip of your nose. So now to practice a simple mindfulness breathing activity, seeing if you can hold your attention on your breath and just noticing with kindness for yourself, noticing when it moves off your breath. So feeling yourself breathe in and out. Noticing when you start thinking about something else or feeling somewhere else in your body. And then gently bring your awareness right back to your breathing. One more time, noticing where you are right now, where your attention is, and bringing it back to just the sensation of your breath. And taking a couple of deep breaths and letting your eyes open. So did anybody notice any shift in how they were feeling right when they started and when they started breathing like that a little bit? What did you notice?
I felt like I was full of a lot of energy, and then I got very relaxed because your voice is very relaxing. I felt like I could fall asleep in this chair.
Okay, so
Like I really needed to
Okay.
rest.
So you felt full of energy, a lot going on, and then as you listened to my voice and paid attention to your breathing, you felt yourself feel like you could almost fall asleep. Anybody else feel like some change like that?
Mine was similar too. Kind of feeling a little anxious and then calm and relaxed at the end.
I noticed as I sat in my chair over here and heard about drugs and thought about my kids growing up and thought about I was about to get up and speak, I started feeling a little anxious, a little nervous, and just as I was doing that with you, I felt a shift. So let me just tell you about meditation and mindfulness and why we're starting to do this all over the place and why it's now being considered an important part of medicine and treatment. We talked about bioneurofeedback and learning to recognize what's going on in your body, and you have great ways to do that here that you're going to hear about. And the next step as you learn about what's going on and you get all that feedback about what's happening in your body, the next step is learning what you can do actually with just your mind and your body to change that. And we have some amazing research right now that is telling us that every person in this room can actually reshape and reform your brain. You can change your brain with your thoughts, with what you're doing with your mind. There was a study of mindfulness meditation. Mindfulness-based stress reduction is the sort of name of this program. And they did before and after studies of people doing 6 weeks of the program. They came once a week for a group. They had 1 6-hour retreat. And they used some recordings and committed to 45 minutes a day of practice, just like what we were doing here. They looked at their brains and measured the prefrontal cortex. And I better get my weeks right if it was 6 or 8, but anyway, in a short number of weeks of this kind of practice for people who had not done anything before, they actually physically changed the size of their brain. They could measure a statistically significant change in the most advanced parts of their brain, more brain matter. So they're rebuilding. You can rebuild your brain with your thoughts. We're also learning that we can damage our brain with our thoughts. So if we have a lot of intense stress over a long period of time, the brain's going to scan in a different way and look different. There are going to be those gaps and those holes and places in the brain that are way overactive and places in the brain that are way underactive. Well, what we're learning is that we can actually make some shifts just by what we do, by doing some of these mind-body activities that we're going to be sharing and working on in the groups. We're going to do some 6-week groups here, so we're working on them. So there are really some very simple things that benefit everybody, not just folks who have particularly different kinds of brains. I worked at Georgetown University and taught in the medical school, and they are, and have been for quite a while now, doing these mind-body skills groups for the students, for the faculty, teaching people how to do this themselves so that they can start to bring that into their own practice. And the reason is that we're learning we can affect our body. We can affect the level of our immune system by changing what we're doing with our brain. We can learn to control and regulate our autonomic nervous system. For adolescents who are having all those brain development issues going on anyway, doing mind-body skills, learning to meditate, learning to know what's going on inside you, and learning to have some techniques to change that. I think some of the most important things that does for especially a teenager is to buy them some time. So you develop the skills to pause. You develop the skills to have a little time between reacting to something and deciding what to do. So it slows things down. It makes it so that we don't so easily leap into kind of a defensive response. It gives us a little time to sit back and say, let me think about this. So for all of us it does that. People who meditate a lot are far less reactive to situations around them. So if meditators seem really calm and peaceful, it's not because things don't happen in their lives. It's because they're practicing and training their brains to operate in a little bit different way that gives them more time and more space and more computer system and a better system in this head to operate a bigger system, a more advanced brain that can operate. So that's why I've gotten into teaching these mind-body skills, because I think they make a huge difference in life. I think as a parent, if you're parenting kids with brain issues, I think as a provider, if you're working in the schools with kids, this is stressful. And life is stressful anyway. But we also need to care for ourselves, and as we care for ourselves, learning and practicing these skills, we can learn to also care for the kids that we work with. I know as a parent that sometimes kids going through all this stuff just really deeply touch your heart, and your heart just aches for the struggles they go through. And there are times when you would really like to kill them. So both things are true, and if we find some peace for ourselves, whether we're the parents, the workers, or we also have ADD and are dealing with it, I think we're going to do a better job of helping things out. Just to tell a little story, my daughter has ADD, learning disabilities, all sorts of things, and she's 35 now. But I noticed she just had a difficult time, learning how to pay attention to other kids and engage with other kids. And the kicker was when she was in elementary school, and I got a note home about head lice. Did anybody ever get a head lice letter or head lice in our classroom? Well, what I found out later was every single girl but my daughter in the classroom had head lice. And you wouldn't want your kid to have head lice, but I thought every single girl, got close enough to the other girls that got head lice, and my daughter didn't get it. So that's one of those break your heart things. And then one time she had a play date finally with one of these girls, and I was driving the car, and I was thinking, oh, this is so great. She's got a play date with a girl. This is really good. And she was just very, very mature. And in the middle of the play date, I was hearing the conversation. It was sounding okay. She turned, she looked at the radio dials. She said, Mom, if you turn your head and you look at the dials on the radio, it kind of makes a little face, And I'm thinking, oh man, you're blowing the play date. Can't you talk about clothes or something? But it's precious too, that some of these young people are are pretty amazing, fantastic people, and if we can help them to harness some of the positives that they have in having a unique brain, really can really make a difference. So that's why I'm teaching the mind-body skills that I'm teaching. Some other good reasons for them is we're learning now about genetics, and we all have genetics, and sometimes we have, our genes have some diseases and other problems, and it's sitting there waiting for us in our bodies. And the study of epigenetics, we're now learning that sometimes genes aren't turned on. So we may have the programming for something, but sometimes those genes are not turned on, so we're not going to have it. They learned in research with long-term meditators, not only do they have this bigger prefrontal cortex in their brain, but one of the other differences that they learn is they look at their genetics, and these things are not turned on. Some of these things are turned off. So we can actually use our mind and our thoughts without any special equipment to have an impact not only on the physical brain, but on the functioning and the biochemistry of our body, and actually influence our genetics, so influence how our life is going to be by changing it. So we are the best pharmacy in the world inside our own body, and we can do things with our mind and body to have an impact on that. I've got about 5 minutes left, and I wonder if you'd like to try one more thing. And this is guided imagery, a little different from mindfulness meditation, but guided imagery is very powerful. Think of how you can think about something. I mean, you may have been thinking during the presentation about drug abuse and about somebody you know who's having a problem and how difficult it is to help them. And maybe you noticed your body reacting when you were worrying about that a little bit. So we are reactive in our body to what we're thinking about. So if we're thinking about, if I'm thinking about I'm going to get up and give a talk on my first day at work here, I'm like, oh man, I hope it goes okay. Or if you're thinking about someone you love who's struggling with drugs, you start to have reactions in your body. And if you think about it, nothing changed except what you were thinking about. And what you were thinking about brought about a reaction in your body. So guided imagery capitalizes on that, and you say, well, if we do that, why don't we also on purpose point our brains at something that will make us feel good and relaxed, and that will help to give us a little more balance in what's going on. So imagery meditation, we can rebalance our autonomic nervous system. We can rebalance our reactivity. So anyway, guided imagery can be focused on helping people with headaches, with healing, with diseases, with chemotherapy, with all sorts of things. It can also just help us relax.
The QEEGs and the neurofeedback here, and I wanted to talk to you a little bit about a new program that we have that we're going to be offering at the clinic. To give you a little bit of background about myself, I got into this field, biological psychology, because of what I saw with my own children. When my daughter was 2, I noticed changes that I could make in her diet and her exercise and things like that. It helped her brain kind of function a little bit better. As she grew, as my knowledge grew, the field was coming about, and I went back to school and studied biological psychology. I like to think of myself as the brain trainer here. Because that's what we're really doing. The QEEGs is looking at the brainwave activity, looking at those different brainwaves. Neurofeedback, we can retrain the brain to be able to help kind of balance those brainwaves, to help an individual overcome certain things. I want to talk today about the Neurotracker program. It's a new program that we have at the clinic, and it's a way to kind of also retrain the brain. So I want to talk a little bit about what brain training is. It's kind of a workout for the brain. We talk about physical exercise and how it's good for the body and the mind. We need to exercise the brain as well. We want to flex those mental muscles to help our brain function a little bit better. Like Sue had said, the more we focus on things, the more we think about things, the stronger those connections get. Hopefully you're doing things in a positive means to help that neuroplasticity of the brain, but sometimes, unfortunately, like we learned from Dr. Stuller, sometimes it can be negative. So we want to, kind of develop those healthy strategies to retrain the brain. one of the exercises I have some of my neurofeedback patients do is looking at coherence. Ooh, those poor people in the webinar. To help with coherence in the brain. So you can do this, kind of follow along with me, or you can do it at home, try to get the kids to do it. Go ahead and put your hands out for me. On your right hand, I want your thumb to go out. On your left hand, I want your pinky to go out. And then I want you to kind of shift. So you're going back and forth, changing, where your thumb on each of the hands. It's a little bit difficult to do. Does take a little bit of practice. But we're really looking at helping the brain communicate with the different hemispheres by just doing that simple exercise. So practice it at the dinner table. Once you get good, challenge the kids, but wait until you get good at it. So really that's what we're talking about. We're talking about neuroplasticity, making those changes to the brain, changing the pathways and the synapses. We talk a lot about, neurons that fire together, wire together. It's true. We want to practice these healthy things to help the brain function better. So the Neurotracker program is going to help to assist specifically with attention and working memory. And we'll talk a little bit more about, kind of how it helps with attention. We're looking at 5 different skill sets with attention to help, everybody function a little bit better. As far as who this program is good for, it's good for anybody. Everybody uses, those skill sets to be able to help them, whether they're a student, whether they're, kind of a business person in meetings, a teacher, or even someone just having conversations. You use a lot of these skill sets, that has to do with attention to function throughout your day. When our attention begins to slip, then we have difficulties in functioning, whether it's, holding a conversation or doing anything that you would, have to throughout your day. So the 5 different skill sets this particular Neurotracker program helps is selective attention, your ability to kind of focus on what is important. Kind of ruling out other distractions. If there's, somebody coughing in the other room or moving their chair, you're still able to focus on what's going on, what the speaker is talking about. Distributed attention is your ability to divide the attention between 2 different tasks. Listening to a speaker and taking notes at the same time, going back and forth between, shifting your attention between 2 different processes. Dynamic attention is, that changing environment. You're looking at, if you're having a conversation, you're reading those emotional cues, the hand gestures, to kind of pull it all into one piece, to be able to process it, to understand it a little bit better. If you're driving, you're kind of focusing on multiple things, where the cars are, where you're going, what's going on in the environment, things like that. Sustained attention is your ability to hold on to, or hold your focus on what's important. As you're processing something, as you're trying to complete something. And then attention stamina is really looking at, your ability to come back to that thing. If you if you're working on a problem or things like that and you can't figure it out, maybe you'll think about it a little bit and maybe come back at a later time and be able to really focus on that. We want all of these things to kind of be working together to be able to help us process things so we can be successful in any aspect of our life. And then, of course, working memory is that, kind of the part of the brain that, or part of our memory that's kind of that whiteboard. It allows us to hold on to some information so we can kind of manipulate it and then use it again. So, obviously when we start seeing kind of decreases in that working memory, we're starting to see kind of deficits in our ability to function. So with the Neurotracker program, what we're doing is helping all of those things. And I'll kind of briefly go over what the program's going to do, and I have a couple video examples of it. The program adjusts to each individual. So before you start training, we're going to do a couple assessment periods to see exactly where you are. And the program is going to change based on how well you're doing, okay? So the examples I'm going to show you are just examples so you can see how the program works. Don't get frustrated if you have a difficult time with the second one in particular. So essentially the program, we have about a 5-foot television screen in my office, which is great if you want to watch movies or anything. But we're using that because it's helping with peripheral vision. It's 3-dimensional, so it's helping with that dynamic attention. We have 3D glasses that you'll wear. And then at the beginning of this session, it'll show you multiple balls. In this particular example, we're using 3 balls to track. Okay, you could do 1 ball all the way up to 4 balls. It kind of just depends what your attention is. Okay, it'll show you what those target balls are at the beginning of this session, and then when the session begins, all of the different balls will turn the same color and they'll begin to move throughout the this 3-dimensional environment. At the end of 6 seconds, it'll ask you which one of the 3 balls there were that were moving, that were your target balls. And then you would kind of put in what they are. They'll give you a number and it'll show you which ball is which, and we'll put in that number. As you advance through, the training, the number of balls may increase, the speed of the balls may increase. There may be different, categories of balls. You might have one that will be blue and then 2 that are orange, and you have to list them in those orders as far as which one you saw first and things like that. So it's going to be constantly changing based on how well you're doing. So on the next, hopefully this video will work. Fingers crossed.
No, I got it elsewhere. Hold on. There we go.
Is this the first one?
Yeah.
Okay. So this speed is 0.6. Okay. We'll see 3 target balls at the very beginning. They'll be orange. They'll turn green, and then all of the balls will start moving through the environment. What you want to do is, I apologize, the video is bad. I had to copy it off another system. You want to kind of focus your attention to the center of the screen. Under this triangle, there's a little green dot. So you want to focus your attention here and allow your peripheral vision to track the balls. Okay? At the end of the session, try to guess which ones, were our target balls. Okay? Okay, you got your numbers?
Right, okay.
Okay. And I apologize, the numbers are kind of small. Just try to get an idea of where those balls were. It seems really simple. Did everybody at 0.6 speed get those balls? Okay. As we progress, again, the speed picks up a little bit. This speed, is this the second video?
No.
The second one is 2.5. So it's a significant jump. Typically the program won't take you so fast, it'll go up by 0.5, but I wanted you to see kind of what those differences are in the speed. Has everybody got their 3 balls? So, again, it's not going to make you frustrated, but it is going to challenge you. It's going to, slowly kind of increase your processing speed. The faster the balls go, obviously, the more processing you're doing to be able to track all of those different things. So, as you're doing this, you're creating that neuroplasticity in the brain, and you're overcoming some of the attention, difficulties that you might have. Neurofeedback is another wonderful way to retrain the brain. It's more of a passive retraining, so you're not actively, really pushing yourself to kind of retrain the brain. The brain is, naturally responding to those positive rewards that you're getting. With this, you're kind of more actively retraining the brain. Both are kind of important, elements as far as treatment. I like this just because a lot of people, this is easy to do. But then the neurofeedback, we have to do a couple electrodes, and depending on what type of neurofeedback we're doing, it might involve more setup. with these appointments, are, about half an hour in duration. There's nothing that we have to apply. You just put your glasses on, we do the training, and you're, kind of ready to go. And quite honestly, it can be good for anybody. Somebody that's having, kind of attention deficit disorder, someone who's just finding that their attention isn't what they want it to be, or their working memory isn't what they want it to be. Essentially within 15 sessions, the research has shown that your attention will increase by 50%. We do 3 sessions in 1 appointment. With the assessment phase and the consolidation phase, it's about 9 appointments. So within 9 appointments, you can see a 50% improvement in your attention. Now, if you continue past that, we'll do more things that challenge the brain. We'll have you standing up while doing this. We'll have you, kind of maybe balancing and doing this. So we're getting more brain regions kind of involved. But, after that 50% point, 50% increase, it kind of slows down a little bit. You're still seeing improvements, but they're not going to be as fast or as great. Okay? Yes, sir?
Is it only on site here, or do you do that online as well?
We're only doing it on site here right now. I know there's options that we can help doing it at home. If we choose to do that in the future. But honestly, the research has shown if you're working with a provider, the results are greater. We are giving, kind of individualized demos. Again, it's not going to be, personalized to your speed necessarily, or your, number of ability, or your ability to track multiple items. But we do want everybody to, if they want, to take advantage of seeing the program and seeing if it's going to be helpful for you. Leslie is our professional outreach coordinator, and she can schedule any of the demos. And if you don't have a good working memory at the time, use the ribbon to help you remember to call for the demo.